Okay, well, let's go ahead and get started. I appreciate everybody spending some time with us today and learning a little bit more about our programs here at Boston College. Just to introduce myself, I'm Steve Bowman. I'm the program director for our online Master of Healthcare Administration program. I'm very happy to be able to share our program and to give you a chance to ask questions about the program and what we're about. So just a little bit about me before we get started. So I have a Master of Health Administration and a PhD, both from the University of Washington. I spent about 15 years in healthcare management and out in Washington State primarily before entering academia. And I have significant experience directing MHA programs as well as doctoral programs in academic settings, and was previously on the faculty of the Johns Hopkins Bloomberg School of Public Health and the University of Arkansas for Medical Sciences. And I'm very, very happy to be leading the Woods College of Advancing Studies MHA program, and we'll talk a little bit more about that in just a second. If you have any problems hearing at all, just use the chat box and let me know. Hopefully you'll have good audio. Please also feel free to jump in and ask any questions as we go about. Typically, the easiest way is to just enter your questions into the chat window, and we'll get back to those as soon as we can. We should have plenty of time for questions, so please feel free to raise any that you might have and any other issues that might be on your mind related to the program. So just a little bit of an overview on Woods College of Advancing Studies. So we are the School of Continuing and Professional Education here at Boston College. And just to give you a little bit of a perspective on it, we really do focus on working professionals and trying to help people balance their work and school and personal lives. And so we have part-time and full-time degrees and certificate programs. And we're really just designed to cater to people that are working in professional positions. And so we don't typically cater to individuals who are coming straight out of an undergraduate program. We really want to help people that are already in professional positions and help them be able to excel and move to the next level. So we have expert faculty and advising here at Boston College. We have both hybrid and online courses. The online MHA program is the only fully online program here at Boston College, and so actually not just within Woods College, but at Boston College overall, we are the only fully online program. And we'll talk a little bit more about that in just a minute. We are highly committed to making sure that we have the academic quality and rigor in our program that will make us one of the top ranked MHA programs in the country. That's our goal. We have a lot of personalization in our environment. We can really bring about sort of tremendous resources in terms of the BC Alumni Network, which is over 180,000 strong in many, many different countries, as well as all across the United States. So you graduate from a degree from Boston College and you become part of a fairly large but intimate club of alums that really do support each other, and it creates a great network for people as they're looking to advance in their professional positions once they graduate. Lots of high-level career services and supports here, both within Woods College and Boston College, as well as specifically to the MHA program. And we are a Jesuit institution, so we're committed to development of the whole person and to helping individuals really dig deeper into the critical thinking about how to really improve society and improve populations, and to be the best leaders that we can in our programs. So the degrees that are currently offered at Woods College, we have a Master of Science in Applied Economics. We have a Master of Science in Cybersecurity Policy and Governance. We have the MHA program, which is the only fully online program, as I mentioned. We have a Master of Science in Leadership and Administration. We do have some certificate programs as well, but I think you're all here today to learn more about our MHA program, and that's certainly the program that I can speak to best. So we just launched our MHA program back in August, and so our first cohort is well underway and are having a great experience so far in the program. And so a couple of early comments from our students. I'll let you read these as opposed to reading them for you. But we really do have a lot of pride in the fact that we are catering to individuals who have busy lives and busy schedules and are doing a lot in their personal and professional lives. And so school needs to fit within that, and we need to make sure that people can have that balance. For me, just as a little bit about my experience as a doctoral student, when I earned my PhD at the University of Washington, I was working full-time in a professional management position for the Washington State Department of Health. And I tried to do the PhD program part-time. And of course, they said, no, you can only do it full-time. We don't cater to people who are working. And I tried to get my employer to allow me to work part-time while I did my doctoral studies. And they said, fine, you can work part-time, but we're going to, we'll pay you less money, but you have to do your full job. And so, for me, trying to find the balance, there really weren't a lot of options. And so traditional higher education often is not very willing to accommodate people who are working. And so that's one of the real draws for me in being part of the Boston College program, is to be able to allow people to both succeed in their professional lives, but also be able to succeed academically and advance themselves in this way. So our program, we have a strong alignment with employers and what employers in the healthcare industry are demanding of future healthcare leaders and managers. We have an industry advisory board that has helped us throughout and continues to help us in terms of designing the curriculum and our competencies to meet their needs in terms of the workforce. And so again, these are organizations that are true leaders in terms of healthcare and are always looking for high quality talent. And so for us to be able to deliver trained individuals who are prepared towards those competencies is really what we're about. And so employers are looking for programs that can graduate individuals that have the skills and competencies that they need in order for their organizations to succeed. It's a convenient program. Our program is such that students typically take one class at a time, and our classes run 8 weeks in length. There's a 2-hour live session that's held one evening per week that you can do from wherever. And so that's really a chance for us to have very in-depth engagement and in terms of discussions and case studies and group activities. We don't do online formal lecturing. That defeats the purpose of having a true online program. And so any of that would be done on your own time. So there's a lot of asynchronous work that you can do at your pace and on your time. And then we bring people together to be able to take advantage of that quality time where we're really in the same room, even if it's a virtual room. A lot of flexibility in our program. So students sometimes ask, if they need to take a term off for personal or work reasons, is that okay? Do they lose a year? And the answer is no. We typically, we allow students to take a term off if they need to, and they can jump right back in, and they might jump in with a different group of students, but there's no gaps in the program. They're able to continue and to move forward and catch right back up if they want to. And really the program's designed to help students who are working in healthcare already, and so to be able to sort of take their careers and jumpstart them and move at a faster pace towards advancement and towards promotions within their organizations. And we'll talk a little bit more about the personalized support that we offer, but one of the great features of our program is that we have a seasoned, well-experienced executive coach who has a lot of years of professional management practice experience, who is assigned to each student. And so that's somebody that you as a student would typically meet with, most often via phone or Skype once a week, to talk about how things are going in the program and to offer any support, both academically, but also really in terms of career strategic planning. How can we help you get to where you want to be with your career as a result of earning this degree? And so concurrently, while you're completing the academic work, you're also preparing and readying yourself for that next step in terms of your career advancement. So the candidates for our program, typically we see sort of, both we see people who are working in healthcare management now in management positions. They might be a financial analyst. They might be, in some cases, relatively senior in hospital administration, but they never finished their master's degree. And so they're coming back to be able to really have sort of a more developed set of competencies that really come about as part of the program. We also see clinicians. We're seeing nurses. We have our current cohort has nurses. We have a physician CEO in the cohort. We have I think incoming here in January, we have physical therapists. We're seeing a whole variety of different individuals who are working in clinical positions and non-clinical positions, and that creates a very rich environment for our discussions in the classes, and we really do learn from each other. And so I think that a lot of the feedback that we've been receiving early on is such that this level of engagement really does have add a lot of value for our students in terms of really being able to work and learn from each other. So interprofessional education in healthcare is really critical, and of course traditionally interprofessional education has been this idea that we have medicine and nursing and pharmacy working together in clinical settings. But more and more, we're seeing that healthcare management and administration needs to be at the table, because when nurses and physicians need something, who writes the check, right? Who's paying for a lot of these decisions and operationalizing some of the logistics. And so really healthcare administrators and managers need to be involved and need to be part of that dialogue throughout. So we really encourage that, and I think it's something that's a real strength of our program. So our basic requirements is that you have 2 years of healthcare experience in a management or supervisorial setting. If you have clinical experience, that's fine too, and we certainly welcome both to the program. And really, this is designed to help assure that you're going to learn from each other, and that you really are able to bring your real-world experience into the program and really add that value. So just a few highlights of it. We talked a little bit about the online courses, and of course having that weekly session that's live, and a lot of self-paced work as well. We have one immersion short course that's held at the Boston College campus, and that's just once during the program over a long weekend. So you'd only be required to come to Boston College to the campus once, and that's a relatively minimal amount of time in order to be able to do some real world innovative projects where we have healthcare leaders that we bring in, and really have that as the central key to sort of bringing together a lot of what we're learning in the program and being able to apply it to real world projects. So that's a real highlight for the program. A lot of people like to come to BC. You don't necessarily want to drive to or come to Chestnut Hill on a weekly basis, but once over the program is certainly a nice way to become part of the BC community. We have competencies that are mapped. Our competency model we'll talk about in a little bit is mapped for every course. And so we can tell you in advance which competencies you'll be developing and assessed on within each course. And that's something that we see as really critical, because as a result of the program, you'll get not only an academic transcript, you'll also get a competency transcript, which really shows how you've succeeded in developing your competencies throughout the program. So we talked a little bit about the online interaction with your peers, and I think we've already started to see that early on in the program with peers both in the courses, but also even beyond the courses, developing networks and really learning from each other and really supporting each other both academically, but also in their professional practices as well. We talked a little bit about the dedicated executive coach, and that's certainly a unique feature of our program. If anybody's familiar with the American College of Healthcare Executives, they have an executive coach service where, if you're a member of ACHE, you can actually pay to have an executive coach do what we're providing as part of the program. So it's a really nice support for students to help them succeed. And of course, there's lots of other opportunities to get involved with, certainly the Medical Group Management Association, the American College of Healthcare Executives, the Healthcare Finance, Management Group, a whole variety of different professional organizations that you can be a part of, and we certainly encourage that. We're a convenient program because we have 6 starts a year. You're really never that far away from being able to get involved with our program. So our next start is mid-January. And so if you're interested in the program, this is a great time to get all the pieces together and get your applications in place. We are a 46 credit master's degree program, and that's in line with our goal of becoming accredited by the Commission on Accreditation of Healthcare Management Education, so CAME, which is the gold standard for MHA programs. And so we are a rigorous program, and we tell people that if you want to learn, this is a great place. And if you're just looking to, to buy a degree and not necessarily learn, then you probably don't want to be a part of the Boston College program. So we really want to provide that value that makes it worth the investment to you. So we talked about our 8-week course format, and that's pretty straightforward. And most students, if you take one course at a time, you're going to finish the program in 2 years. And so for a master's degree, when you're working full time, that's pretty good. My program that I previously directed, the part-time program was on ground, where students would come to campus 2 nights a week, and it took 4 years to get a master's degree as a part-time student. So 2 years doing it online is certainly more accessible and more friendly to working professionals with families. And so here's just a list of our courses, the honeycomb here. These are the course titles. But throughout, initially the first course is the Introduction to Healthcare Systems and Organizations, and that's really our prerequisite course for all of the other courses, really to give you sort of a level playing field in terms of your knowledge of some of the basics. And also being able to give you a little bit of extra time to make sure that you're familiar with our learning management system and the technology, and that in a friendly way we can make sure that you're comfortable with the online format. Health policy, our healthcare quality management course is designed to give you the basic tools that you would need to potentially be able to sit for a Green Belt Lean Six Sigma certification. You don't get the certification as part of the course itself, but the tools that you develop through this course really is designed to help you get to that point. And again, having a real world project in your workplace is critical to being able to sit for a certification. But a lot of people are certainly looking for individuals with Lean Six Sigma training, and certainly from an employer standpoint, this is a real strength. And so you get a feel for sort of the general overview of these courses. There's I think a lot of opportunity to really dig deep into it. We integrate the Jesuit values throughout the curriculum, and when I say that, what we're really talking about is really encouraging deeper thinking and more critical thinking throughout. I've spent a lot of time, with some of my colleagues who are CEOs of large healthcare systems and hospitals. And, they've told me, what keeps me up at night is not whether my financial margin was 1.5% or 2% last quarter. What keeps me up at night is the impact that we have on people and our patients, our families. And so sometimes that conflict between, what's perhaps best financially for the organization and what that impact might be on consumers and patients, is really struggling for individuals in terms of those that are in leadership roles. And so what we want to do is really help encourage people to think a little bit deeper, to do more critical thinking, come up with more solutions and potential avenues by which we can address both. We can have good, solid bottom lines financially, but also address the human side as well. So, and again, all of this is aligned with our industry partners who are fully on board and really want to be a part of the program in a way that can assure that they're getting the workforce that they need as a result of programs like this. And so, we have 19 competencies that make up our program, and we don't want to spend a lot of time here. We're happy to share those competencies with you, but they're all within these 5 domains, and these domains are standard across all CAME accredited MHA programs. And so the leadership, professionalism, and ethics is certainly one that gets a lot of attention. Domain 2 on communications and relationships. Looking at management and strategy. So strategy, we used to think a lot about strategic planning, and we still do, but strategy has become that much more meaningful, and sort of the intersection with finance as well. Measurement and analysis, giving you some of the analytic tools that will allow you to succeed in using big data. So most large healthcare organizations have adopted electronic health records, whether it's Epic or another EHR system. And now the challenge is, we're putting all this great, patient data into these systems. How do we make sense of it? how do we use that information to do predictive analytics? How can we identify, where there's opportunities to make improvements? And it could be something as simple as, how do we predict who's not going to show up for their clinic appointments so that we can then create interventions to help improve that? So from an operational standpoint, to how can we predict which patients are going to have a preventable readmission back into the hospital. Of course, with financing the way it is now in healthcare, a lot of those preventable readmissions are not reimbursed, and so for hospitals, they have to eat the money if they have preventable readmissions. And so this is a major priority for healthcare systems right now. And so developing talent that really has the analytic capabilities and tools is really critical. And of course, having that broad depth of knowledge about the healthcare environment and is certainly not something that's going to be foreign to many of you, but this is really a key feature when you start looking at problem solving and planning for healthcare systems and organizations. And so our competency models really, this again is industry driven. It's what, the experts in the field are really saying is necessary for effective leaders and managers and from these types of programs. So these are just some examples of what these competencies would be. And so, within the leadership and professionalism and ethics. And so, for each of these, they'll be mapped to specific courses. And then those courses will have assessments that will really help you to demonstrate how well you've achieved these competencies in each of these areas. And so lots of opportunity to be able to develop these competencies across different courses. It's not any one course that's going to help you master competencies in any one area, that it's really sort of multi-pronged and that you're going to get good practice. I like to think of academic environments as really safe environments for developing your skills and competencies, and you really want to see that, be able to demonstrate that throughout as part of these programs. And so we really focus on that. Okay, so for our admissions, we have a minimum GPA of a 3.0. It is possible if your GPA is below 3.0, we will still consider you. We do strongly recommend that you submit a GRE or GMAT test scores to help strengthen your application. And so if you're somebody with 20 years of high-level healthcare management, senior management experience, and your GPA is below a 3.0, we're certainly going to consider that. So we would definitely encourage you to, to at least be able to, try to present as full a package as you can in terms of why, you think you'll benefit from our program. And your personal statement really allows you to do that. So there's no magic to the personal statement. It's really your opportunity to help our admissions committee learn a little bit more about you and why you think you're a good fit for our program and what you're hoping to get out of it. We require transcripts and a resume and 2 letters of recommendation. So pretty straightforward, and we certainly can help you. We've got some great admission specialists that are application specialists that can really help facilitate making this process as painless as possible to go through. And so what I'd like to do now, just briefly mention the tuitions, and then we'll open it up for questions. So our tuition rate is $1,100 per credit. We do have an opportunity for those that are employees of one of our partner organizations to get a discount of $100 per credit. And so if you're not sure about whether your organization is one of our partners, please do, when you contact us, ask about that, and we can let you know. And if we're not currently in a situation where we have a partnership agreement with your organization, we can certainly try to make that happen as quick as we can so that you can benefit from that. Pretty straightforward financial aid through the Boston College Financial Aid Office. There's a link on here, and we can send all these slides out to you as well after this, so you'll be able to have this information if you're interested in learning a little bit more about that. So what I'd like to do is just open it up. Here's some additional contact information for me and for Emily Raviola, who's our operations manager here at the MHA program, and also, of course, encouraging you to visit the website. Many of you already have, as well as feel free to call or email and get the process going to learn a little bit more about the program and if you have specific questions. So let's go ahead and open it up now. If you have any questions, please feel free to use the chat box, and we'll be glad to answer any that we can. Okay. All right, I see some people typing, so let me just give it a little bit here. Yeah, so one of the questions was if asked if we could talk a little bit more about the role of the success coach, and I would be happy to do that. So these are our executive coach. We have one executive coach now. If as our program grows, we will always have enough executive coaches to make sure that you get personalized service, and really what that person's doing is meeting with you weekly. If you're here in Boston, sometimes our current executive coach will meet face to face and meet over coffee and just talk about how the program's going and what additional support would help you to succeed in the program. But more, I think, really talking about sort of what are your career ambitions and where do you want to go with your career, and how can we help you do a lot of that planning now to help prepare you for when you complete your degree. So it might be developing your network, your professional network, positioning yourself to start meeting people and developing informal mentors early on while you're in the program, so that by the time you graduate, you'll be ready to really take that next step in your career. Now, again, this is going to vary by each individual student. For some students who are well on a track within a healthcare organization, they may have different needs and different desires in terms of how this person might help them. But it's very personalized in terms of the support, and so far it's been a great strength, and the students are reporting that it's really valuable. In terms of financing education, students typically have a few different options, and so many healthcare employers have a tuition benefit that provides some support each year for students. And so in some cases, they provide a very significant amount of support. Other students access through the BC Financial Aid Office student loans, and those are available to those. There are a few scholarships and grants available, and we certainly encourage people to take advantage of at least exploring what those might be. But with many professional degree programs like this, whether it's an MBA or an MHA, often the return on the investment is there, and so people are able to take out loans and be able to justify supporting their education and being able to pay that back based on the benefit. We had an individual that we met with recently who was over a whole group of practice administrators, and he said to us, this type of a program is perfect for our group because basically for them the difference between a bachelor's degree and a master's degree is about a 50% bump in their pay. So for some individuals, it's a matter of you really getting these degrees, and so supporting financially the program can make really good sense for individuals who are going to see a really dramatic jump in their pay as a result of the graduate education. So one of the questions so I think, let's see, I'm just looking through some of the chat boxes. So students, you can certainly take less. So we have some students that will self-pay. They'll want to just pay their own way, and they want to take maybe one course a semester instead of two. And that's certainly fine. We certainly are very accommodating and supportive of that. To be eligible for financial aid, you typically need 2 courses each semester, and so that on a weekly basis, you figure out that a 4-credit course that we offer is about 20 hours a week of work. So taking one course for working professionals is usually the right amount of work to be able to balance family and professional life with academics. And so, that just kind of gives you a little bit of a nutshell on that. I'm just trying to read through the chat boxes here. So one question had to do with our program's faculty. We have a great mix of faculty who have a lot of practice-based experience as well as academic training. And so we have individuals that just bring a wealth of real-world experience into the classroom in terms of their research as well. So if you have questions about the healthcare experience requirement, I would encourage you to reach out to one of our application specialists and just present, your specific situation. And we're always happy to look at any given situation and to see whether we think that healthcare experience that you have would meet our requirements, even if it's a little bit different. So, for example, we've had somebody that's working in pharmaceuticals and has been for a long time, and it doesn't necessarily exactly fit one of these or the other in terms of our experience requirements, but clearly the individual brings a great wealth of experience working with healthcare organizations, and that can be very appropriate depending on the situation. So I would encourage you just to reach out and ask, and we'll be glad to review that. So industry leaders have been involved. One of the questions you have is how are industry leaders involved with the curriculum development? And so we've had an industry advisory board that's been, involved from the beginning. And so this is in terms of developing the competency models, in terms of developing the courses that make up our curriculum. But in some cases, they're actually teaching and they're involved in the program, both in terms of helping to develop the courses as well as to teaching these once they are developed. And so we see that as a really critical part of our program is having that strong linkage with industry. It makes for a much higher quality learning experience for students. We make sure that we stay relevant and that students are getting what employers are demanding. And okay, so then one of the questions, so just a little bit more just to reiterate on the online component of our program, so synchronous versus asynchronous. So each week, again, of the roughly 20 hours a week that you can expect to spend on our program, if you're taking one course at a time, really 2 hours of that is synchronous. That means that's live, online, where we're all together. The rest of the time, you're studying at your pace on your time. So we have deadlines, for our class discussions and assignments, but really when you do it is up to you. And so with the exception of the live session, there's a lot of flexibility in terms of when you can do that. So we have students that, that will download readings and podcasts, and they'll be working on the exercise equipment at the gym while they're listening to their lectures or listening to different aspects of the required media content, whatever works for you. And that's one of the real nice approaches to this type of a program is that we all have different studying and learning styles, and this type of a model allows you to figure out what works best for you and to make it fit within your world. So we are authorized in many states to allow students to participate in our program. And so if you go out to our BC MHA program website, at the bottom there it'll say state authorizations, and you can see we're authorized in I think 36 states now. So most states do fit the bill, and we're able to certainly have students coming from our states. The typical live session, one question was about, what is a typical live session like? And is there a lecture, or do we do presentations or something else like that? And the reality of it is that it's going to vary by course. And so we like to keep it, innovative and engaging. And so what you won't typically see is, any 2-hour lectures by faculty. That's just not what we're about. So we will have, individual case discussions where we might have student-led discussions on particular issues. In some cases, it's presentations where we have teams of students presenting on a topic. In other cases, we'll have, sort of mini lectures that really result in more discussion from the students. But it'll vary based on the topic of the class. So for example, our health policy class, we might have a different kind of debates related to health policy issues. And so really, jumping into some of the specifics that are really exciting to people, but also challenging in terms of what we're dealing with on a national level in terms of policy. When we get into the healthcare analytics course, we might have more mini lectures and actual demonstrations of how we do some of the analytics, right? So it's going to vary based on each individual course, but the common theme is that it's going to be engaging. If it's just information being pushed, we wouldn't need to do that as a live session. So we really want to take advantage of the live sessions for what really benefits from having people together at the same time. So, the one question here was, so how would BC's Jesuit tradition impact the program, or would it? And what I would say here is that we're a little bit unique because there are many MHA programs out there that are offering a very business focused approach to healthcare management, and there's nothing wrong with that. But the Jesuit tradition is really giving us the opportunity to help develop leaders more completely. And so I think we certainly see that as a real strength of the BC program in terms of being able to really to build on that and be able to help individuals think more broadly about the impact of their decisions and their leadership. Okay, and I'm still reading through some of the chat. These are great questions, so I'm glad we can kind of throw all these out here, and feel free to keep them coming. So one question that was brought up here was, how can we do networking given that this is an online program? And so what do current students do to grow their networks? And so one of the things that we do is really encourage students to become student members in any one of a number of different professional associations. So for example, the American College of Healthcare Executives has a student membership program, which is very low cost, and it allows you to automatically become a member of the local chapter of the American College of Healthcare Executives. And in doing so, you can also then be eligible for their formal mentoring program for students, which is without cost. You can get discounts to any of their educational networking sessions that they do on a regular basis. It's a great way to get involved early. And so the other thing we certainly encourage students to get involved with LinkedIn and to sort of help develop their own professional profiles, and to start connecting and engaging with each other, but then building their networks beyond that. And so it works really well. So one of the questions that came up, so the career services supports from Boston College, and so once you become a BC alum. So again, even though this program is online, you have full access to everything that BC has to offer. So if you happen to be here and you come to a football game or a sporting event, or you want to come and use the libraries on campus here, all of the resources that are available to BC graduate students are available to BC students who are taking our program online. So, but career services is one area that people have certainly asked about. I mean, we have a huge network. I mean, 180,000 alums around the world. It's a pretty tight club. If you say you're a BC alum, it doesn't take long to find somebody else who's a BC alum who really supports that and wants to be a part of that. So you can certainly take advantage of different counseling sessions, resume building workshops, and mock interviews, and a lot of those other supports that we offer here as part of the BC Career Center. And so we would certainly encourage that. And I think more as we grow, we'll have some of those services available online as well. So the immersion course, one of the questions that came up was, so what's the purpose of the immersion course? And this is really an innovations course where we want to allow people to sort of take what they're learning through the program and come together with healthcare leaders from the field who are looking for solutions to some real world problems. And we typically have this as an opportunity for students to tackle as teams some real world projects. And so we want to immerse them in to this, giving them some face-to-face time to really to develop a lot of that potential engagement where they're really coming up with solutions to real world problems with the involvement and sort of participation of healthcare leaders from this field. So that's really a focus on that. Let's see, one of the other questions is it possible to integrate some of what I'm currently working on at work into some of my class projects? And I would say it's a great question, and certainly that does become an option. In some cases, it's going to depend on the course and depend on what your work is. but we certainly encourage that. We don't have a formal capstone course or project that you have to do. So you don't have a thesis to write or anything like that, but you can certainly take real world projects and apply them as appropriate throughout the curriculum in each course. So it's going to vary by individual course, but there's certainly opportunities to do that. And we would certainly encourage that. And it's a great way to be engaged. And so from my experience is that, any school-based projects that you're working on, if it's related to something that you're passionate about or something you're working on a regular basis, it's that much easier to complete the assignments. And so we certainly encourage that. So I think I've covered most of these. Any other questions here? I'll say application deadline. So for the January start, well, we would encourage you to have by the first of the year, get all your material in so that we can make sure that we get your application processed and admission decision and allow you time to, if you want financial aid, to be able to go through that process and to have your books ready and everything ready to go by the time we start class on the 17th of January. So you pretty much have the month of December. So I would encourage you to start early and get ahead of it. It really doesn't take that long. And certainly there's a lot of support that we can provide in terms of helping to make that as easy as possible to get through. But I would encourage you not to wait. Just get going now so you'll be done with it. So one other question that one of you had was, do you take courses all year long? And the answer is yes. I mean, there are some breaks here and there, but we are a year-round program, and so you would take classes in the summer. And again, if you decide you want to take a break for a term, our program is very flexible, so it gives you the opportunity to simply say, I want to take a term off, and you're not penalized for it. You don't have to wait a year to start up again. You can just jump right back in. So, that's a real strength. And obviously, people have lives and families, and so some things do come up that require some flexibility, and we're really very supportive about that. So, okay. Any final questions? So I want to thank everybody for spending the time with us today, and do feel free to reach out to any of us if you have any further questions. If we can be of any assistance, we're here to help, and we want to see you succeed in the program. So with that, I will go ahead and we'll sign off and let everybody enjoy the rest of their day. So thank you.